It's time for the kids. Pfizer and BioNTech say they have officially submitted a request for emergency use authorization of their COVID-19 vaccine for children ages 5 to 11. Thanks for joining us at 5. I'm Rolly Hoyt.
And I'm Marlisa Goldsmith. The FDA has set October 26th as the date for advisors to discuss Pfizer's application. Now, if authorized, it would be the first COVID-19 vaccine for younger children. And just to put it into perspective for you, back in the spring, the FDA authorized the vaccine for children between the ages of 12 and 15, about a month or so after Pfizer filed for that age group. So children could potentially start getting the shot in November.
Now here in Arkansas, October is expected to be a busy month for healthcare workers. Boosters are rolling out, and now there's the possibility that younger children could start receiving the vaccine as well.
So is the state really ready to handle another surge in vaccine demand? THV 11's Jordan Howington took that question to the person in charge of our state supply.
Colonel Rob Ader is in charge of vaccine distribution here in Arkansas. He says the state is prepared to give COVID-19 vaccines to 312,000 children. There's enough doses for every kid in Arkansas, plus to stay on top of the booster rollout.
We try and hold about a 2-week supply of vaccine in the state in every county so that we're in a position to whatever happens that we're able to go ahead and get the vaccines out.
Statewide, there's just under a 5-week supply of the COVID-19 vaccine, including Pfizer. That puts us in a good position if the FDA agrees to give Pfizer vaccine emergency use authorization for children ages 5 to 11. The agency plans to discuss it later this month. Meanwhile, local pharmacies are prepared for another influx.
There is a demand for shots in children those ages 5 to 11.
Philip Way is a pharmacist at Little Rock's Remedy Drug. He expects an initial rush of young kids once the vaccine gets approval.
It's exciting. Those families that want their kids vaccinated have been waiting for this, and it'll be a huge sigh of relief for them.
Way says parents and guardians should plan to make an appointment before coming in. So far, at least 50% of kids ages 12 to 18 in Arkansas have either received one or both doses of the vaccine. Some local pharmacies are already getting questions from parents eager to have their young children vaccinated, though ADH still expects more hesitancy in the 5 to 11 age group.
I expect it to be just a little bit lower with the smaller kids, just because of the age of the parents that those kids belong to.
Jordan Howington, THV 11 News.